Hey everyone, and welcome to this explainer. Today we're looking at something you have probably seen heavily promoted online or maybe even at your local med spa. It's called Forma V. We are going to completely demystify this so-called feminine rejuvenation treatment. We're going to look right past those glossy marketing brochures and dig straight into the actual clinical evidence.
Okay, let's dive into this. Here is our roadmap for today. We'll cover intimate wellness and aging, the science of Forma V, the patient experience, efficacy and clinical evidence, and finally, safety and FDA warnings.
Starting off with Section 1, Intimate Wellness and Aging.
First, we really need to acknowledge the very real, very physical changes that women experience as they get older or after childbirth. Vaginal laxity, dryness, and mild incontinence are incredibly common, especially postpartum or postmenopause. And these aren't just minor inconveniences, right? These symptoms deeply affect a woman's quality of life, her confidence, and her day-to-day comfort. And this is exactly the problem that clinics and devices like Forma V claim to solve. They're basically offering a non-surgical promise to restore intimate wellness.
That brings us to Section 2, the science of Forma V. Now, what's really interesting about this technology is how it actually works. It's driven by bipolar radiofrequency, or RF for short. Energy is delivered via a specialized handpiece that gently heats the deeper tissue layers to a very specific, carefully controlled 40 to 45 degrees Celsius. The absolutely key thing here is that it heats the tissue underneath without burning the surface. It's a highly temperature-controlled process designed specifically to stimulate a biological response.
And the biological response basically happens in three main steps. Now, medically, they use fancy terms like neocollagenesis and neoelastogenesis, but essentially, the heat causes your existing collagen to instantly contract and tighten. Then it wakes up elastin production. You can think of elastin as waking up the tissue's natural springiness. Finally, blood flow to the area significantly increases. So it's basically tricking your body into a healing response to rejuvenate the tissue from the inside out.
Moving right along to Section 3, the patient experience. So what does a patient actually go through during and after this procedure? The timeline for results is quite fascinating. According to the clinical protocols, this isn't some magic overnight fix, mostly because tissue remodeling just takes time. After the very first session, patients often report immediate relief from dryness and noticeably better hydration. By sessions 2 and 3, which are usually spaced a few weeks apart, the progressive building of tone and tightness really starts to kick in. But the peak results? Those don't actually show up until 2 to 3 months after the final session, as all that new collagen fully matures.
Crucial point here is that this procedure isn't for everyone. If we look directly at the clinic's intake and consent forms, there are strict contraindications. You should absolutely avoid this if you have a pacemaker or an electrical implant, if you're pregnant or nursing, if you've had recent pelvic surgery within the last 6 months, or if you have any active infections, a history of pelvic cancer, or an uncontrolled autoimmune disease. Safety always has to come first.
All right, on to Section 4, Efficacy and Clinical Evidence.
This brings us to the ultimate reality check. I have to ask you, what does the science actually say? When we strip away all the glossy brochures and the glowing testimonials, does the hard biological data actually hold up?
Well, it's really a tale of two realities. On one hand, observational studies show incredibly high patient satisfaction, reports of excellent tissue improvement, and real symptom relief. But on the flip side, when you look at systematic reviews and randomized controlled trials, the gold standard of medicine, they reveal a massive placebo effect. Thus, there is a distinct lack of large-scale trials, and this brilliantly illustrates just how deep the complexity goes. Tissue biopsies do actually prove that radiofrequency changes the tissue at a microscopic level. We see increased type 3 collagen, higher cellularity of fibroblasts, and neoangiogenesis, which just means more blood vessels. So the tissue is undeniably, literally remodeling itself, even if the actual clinical significance of the symptom relief is highly debated because of that massive placebo effect we just talked about.
Which leads us to our final section, Section 5, Safety and FDA Warnings.
Let's see how this builds into a highly complex picture for the consumer. On one side, the FDA and the American College of Obstetricians and Gynecologists issued severe warnings back in 2018 about potential risks. We're talking vaginal burns, scarring, and chronic pain. Yet, if you look at the current medical literature and observational studies, they mostly report very mild, transient side effects like temporary redness, mild pain, or slight swelling. It's a stark, pretty confusing contrast between regulatory caution and clinical observation. All of this leaves us with one final, really important thought.
Better watch out, going for the knockout.